right, I think we are getting started. Hello, everyone. Thank you so much for joining. I'm so happy that you are here. I am very appreciative of those of you that are in different time zones. It is 10 o'clock Eastern Standard Time, but I'm so grateful for you that are in different time zones that are sacrificing your time in the morning to join. So thank you so much. My name is Arnita Roberts-Christie, and I am one of the patient engagement liaisons here at GlaxoSmithKline. So a couple things before we get started. Number one, you will see a pink box on the bottom of your screen. And inside that pink box, it looks like a check box, or a clipboard. That's what I want to say. It looks like a clipboard. If you wouldn't mind, please clicking on that pink box for the clipboard, and that has some pre-event survey questions. What we want to do is find out where you are in your thought process, in your understanding, and perhaps even in your expectations. We had tried to work to see if we could get another option to say if you were a patient, an HCP, or a caregiver. Not sure if we were able to do that. However, if you are a caregiver and the only two options that you can press, if you would press the, you decide. I don't want to tell you what to press, but if you could, please complete the pre-event survey. That will help us to understand where we're getting started. And you best believe there will be a post-event survey, and that will be a different colored box, which I will tell you later. You have a lot of boxes on your screen, so at any given point, feel free to click in the upper right-hand corner to minimize the boxes that we're not using. We are using the Us and Lupus Caring for Someone with Lupus box. That should be the biggest one. And if you go to the upper right-hand corner of that box, you can actually make that box larger so that that covers your screen and it blocks out any additional distractions. So again, if you have not done so already, please click on the pink box, which has a clipboard in it. There are about 3 questions that we're asking that you complete. I am so happy that you've joined us. Again, my name is Arnita Roberts-Christie. I am one of the patient engagement liaisons here at GlaxoSmithKline. I am also a registered nurse with about 10 years of experience in the immunology as well as working with lupus patients. And so even though I am a registered nurse, my goal here is to help you, the caregiver, understand how your lupus warrior is living with lupus and how you can support them as well as support yourself. So this is about you today, but we're also going to incorporate understanding of what your warrior, your lupus family member, friend, coworker, child is going through. So hopefully I've given you enough time to complete that pre-event survey, which is the pink box. And now we will get started. Let's see, a couple more things. I do have a virtual background, so you may see some different things in behind you, so just bear with me. And another thing, with this virtual background, there will be a couple of seconds delay. So I want you to focus on the screen, focus on the slides, not on my picture, but focus on the slides, because that is what's really important. If you focus on me, it might throw you off a little bit. And I'm not important. Your education and these slides are important. So focus on the slides, and we will now get started. There's a couple areas I want to cover with you today, actually 5. One is educating yourself about lupus. I believe that it's really important, no matter how long someone has had an understanding of lupus or how long you've been in the arena of lupus, it's always important to make sure that we are starting at the same level, and I call it a playing field, that we're all in this ballpark together, and we need to be on the same page. I want to also talk about helping manage the lupus lifestyle. How can you help your loved one manage this lifestyle? Communicating with your loved one. Communication sometimes is verbal. It's also with your eyes. What do you see when you see your loved one? And it's also what you hear. So we're going to incorporate all of our senses. How do they feel when you touch them if they are having a flare? Sometimes a hug goes a long way. So let's use all of our senses as we are communicating with our loved ones. Understanding that your lupus loved one has a whole healthcare team. And if you're not familiar with who's on their team, because you're on their team too, but if you're not familiar with who's on their team, I want to help bring that information to you so that you know just as much information as they do. And then, of course, caring for yourself. You are in this journey with your loved one, and you are caring for them with your coworker, with your family member, with your child, and you are caring for them. But who cares for you? Are you taking the time to take care of you? So we're going to talk about that as well. And so understanding the basics of lupus. So remember I talked about everyone being on the same level playing field? Well, that's where we're going to start with right now. So let's talk about a chronic illness. A chronic illness is defined as an illness that lasts for more than 3 months. And so, unfortunately, a chronic illness cannot be cured. However, it can be managed with some interaction and with some support of healthcare providers. What we see from the screen is that 6 in 10 adults in the United States are living with a chronic illness, and that 4 in 10 of those adults living in the United States have 2 or more chronic illnesses. So chronic illness can be cancer. It could be diabetes. It could be heart disease. These are diseases that last for longer than 3 months and that the person will always have them. However, these diseases can be managed. And so I want to make sure that you understand your loved one living with lupus, which is identified as a chronic illness, is not alone. And you, as the loved one, the caretaker, you are not alone, because there are a number, lots and lots of people that are taking care of loved ones living with this disease. And so, as I stated before, lupus is a chronic illness. It is a long-term illness, and it can cause pain and inflammation affecting multiple organs or multiple areas of the body. We're going to go into this a little bit deeper, but as I stated, lupus as a chronic illness cannot be cured. However, with some intervention, with some support, with possibly some changes to medication, it can be controlled. What we know about lupus and this disease is that it affects women of childbearing age more than it affects other genders. Now, let me make sure that I do say it does affect men. And when it affects men, because they may have been living with the disease longer than possibly a woman, when they are diagnosed, it may be at a more severe state, because sometimes the male gender will not recognize that they are feeling the symptoms that they are feeling. So understand, so let's again level the playing field. On average, it takes anywhere from 4 to 6 years sometimes for lupus to be diagnosed in everyone. And possibly it will take longer for it to be diagnosed in men. And so women of childbearing age, once you've started menstruation, sometimes you can be diagnosed with lupus. But what I am hearing in the communities that we serve and that we educate is that I'm seeing an upsurge of women who are also menopausal stage that are also being diagnosed with that are being diagnosed with lupus. So understand that there's a lot of different opportunities for someone to be diagnosed with lupus along this life journey that we're living. We have at GSK what we call an Us in Lupus program. This Us in Lupus program has a Facebook page, it has a Twitter, it has a website. There are a number of different social media outlets where you can tap into our resources. And on this particular day, this lupus warrior decided to make a comment and decided to type in, "Every day is unpredictable." And the cycle of lupus occurs, it's like hills and valleys. I call it, oftentimes, if you've ever heard me present, I call it like going to sleep like a gentle cub and then waking up like a roaring lion. So when the lupus is in remission, it goes to sleep like a gentle cub. When it wakes up, when it's flaring in your loved one, in your coworker, in your child, it's like a roaring lion. Different parts of the body become involved and they become inflamed. Different parts of the body is that lupus will attack because the body doesn't recognize its own cells. And so everyone has an immune system. And this immune system that we have protects us from viruses. It protects us from bacteria. But when the immune system does not recognize its own cells, it creates a fight within the body. And it's called like an antigen antibody complex. And with that fight, as lupus cells travel in your blood system, it can stop in different parts of your body. And when it does, and that fight starts, it causes inflammation. And that inflammation can make itself known as pain, as swelling, as uncomfortable. It can be hot to touch. And think about it. If you've ever cut your finger like a paper cut, you know that is, it could be so small, but it is very painful. And if it gets a little bit of infection, it becomes swollen or inflamed. It becomes warm to touch. It becomes painful. And that's what happens when a flare happens within the body of someone that is living with lupus. Lupus can often change. We often say in the community, one person diagnosed with lupus is one person diagnosed with lupus. It affects all of us differently, different times of the day, different days of the week, different days of the month. And so the severity levels are also different. I mentioned that lupus affects different parts of the body. Well, when it affects parts of the body that you cannot see with your eye, those parts of the body are, for instance, sometimes you can see it and sometimes you cannot see joint pain. Sometimes you can see your loved one feeling fatigue, sometimes you cannot. Sometimes you can see a fever, sometimes you cannot. Sometimes you cannot see, blood disorders, when someone's anemic, when their blood is not producing enough red blood cells, or when lupus involves the kidneys and you cannot see the inflammation inside. Sometimes your loved one can look in the toilet and see like tiny bubbles, or can see that their urine has changed color. And that could be an indication that lupus is affecting the kidney, but sometimes you cannot. Sometimes your loved one may be short of breath or may have chest discomfort, and sometimes they may not. And so what you see on the screen is a list of invisible symptoms that you may not be able to see with your eye that your loved one is dealing with. This is not an exhaustive list, meaning this does not include all of the symptoms that your loved one is living with, but it's a really good starting point for what they may be experiencing. And as we go back to our Us in Lupus site, and you can get there by going to usinlupus.com. And I also wanted to mention at the beginning, if you are viewing this presentation on your cell phone, there will be an opportunity at the end of this presentation for you to click a QR code or to bring your phone up to the screen, and there will be a QR code that will, you will put, when you bring your phone up to the screen and click the camera on button on your screen, it will bring brackets around the QR code, and you can press that and go right to the Us in Lupus website. But this lupus warrior decided to write, it is definitely an invisible disease. Through it all, we have to keep pushing and encourage your loved one to keep pushing, to keep fighting as they go through this journey. And so I have a question for you. How long has your loved one been living with lupus? Do you know? On average, I mentioned it takes 4 to 6 years for diagnosis. Many times patients are living with lupus years before they actually get a diagnosis. And so as a caregiver, if you're not sure, find some time to ask your loved one, how long have you been living with this disease if you're not aware of it? Because that can tell you how long they've been in this fight and how long that they have been on this journey. And so as we continue, lupus can cause long-term organ damage. And so you might say, Arnita, what do you mean by long-term organ damage? Lupus can affect the tissues and the blood vessels in various parts of our bodies. And what you see on the screen are systems that are represented by the different organs on the body. The system that involves the brain, lupus can affect the small blood vessels in the brain. I already mentioned it can affect, and when it affects the brain, it can cause an opportunity for your loved one, your coworker, your family member, or your child to be confused or to get easily confused, or it may affect their memory. When it affects their lungs, they could become short of breath. They could develop chest pain in terms of it affecting their heart. Their muscles and their joints may become inflamed. And how does that show up? Maybe they wear a certain ring every day, and today they just can't put that ring on. Or perhaps they wear a certain shoe that they just love, but today it's much more difficult to put their foot inside that shoe. And maybe it affects their kidneys, and they look in the toilet and they see those tiny bubbles, or they notice, my urine is usually a light color, but today it's a darker yellow. And then perhaps it affects their skin. Perhaps they are dealing with something that's called discoid lupus, where it could affect their skin, and they may have what's called a butterfly rash, or they may have a rash on their arms or in their upper chest, or perhaps they're losing their hair and they have different spots that are on their scalp that hair is not growing. So listed again on your screen are different areas where lupus can cause long-term organ damage. And again, this is not a comprehensive list, which meaning this is not every different place that lupus can show up in long-term damage, but it is a good list where you can look at it and say, these are some of the areas where lupus can affect these parts of the body. And so let's get a better understanding of what lupus is. I did tell you a little bit, but now we're going to go into a little bit more and talk about the importance of tracking symptoms and managing triggers. This is where you can have a very integrative role in helping your loved one with this. Now, on a given day, I forget what happens yesterday. And if lupus decides that it's going to take residence in the brain, your loved one may also forget what happened yesterday or the week before. But one way that can help them remember what's happening is to track their symptoms. That means they can write down what they're feeling today, what they felt all week, and you can help them. You can ask them, you know, Arnita, you didn't look like you were feeling so well yesterday. Did you happen to write that down? You can write it down. I say write down because of the age that I am, and I love writing things down. But perhaps your loved one likes to, perhaps they have a smartphone and they want to type things in the notes section of their smartphone. Why is this tracking your symptoms important? Well, what you can do is encourage your loved one when they go to visit their healthcare provider the next time. They can take the information that they wrote down and show it to their doctor, show it to their healthcare provider. They can say, you know what, it appears, and their healthcare provider can look at it and say, well, Arnita, you wrote down, you know, the third week of the last 3 months. Let's dig a little bit deeper. Let me ask you some questions to see if I can figure out what's happening around the third week of the month that aggravates your lupus, that makes your symptoms worse, that wakes up that roaring lion. And if you go to the healthcare doctor's office with them, you can remind them, Arnita, did you remember that a couple weeks ago you weren't feeling well after you spent a little time in the sun? And so I want to encourage you to encourage your to encourage your loved one, that every symptom matters. Let your healthcare provider or let your loved one's healthcare provider decide what symptom is related to their lupus or what symptom is not related to their lupus. On the screen, you see a number of different symptoms, whether it's joint pain, it's fatigue, it's joint swelling. Perhaps they're having issues with their vision, chest pain. Perhaps they're in the sun between certain hours where the ultraviolet rays are a lot stronger, and that aggravates. But the important thing is to make sure whatever symptom they are experiencing, that they share those symptoms with their healthcare provider. And so as your loved one is living with this disease, there will be certain things that trigger their body. There will be certain things that wake up that roaring lion, that gentle cub, that it becomes a roaring lion. This particular lupus warrior wrote in our Us in Lupus program to say, know your triggers, educate yourself and your friends and family. My husband has been there with me, my husband has been there for me throughout it all. Get a support person. Keep your head up. You are not alone. And so that is what this particular visitor listed or wrote in as they visited our Us in Lupus site. And you can also visit the site as a caregiver and say, as a caregiver, I watch, and then decide what else you want to say after that information. So let's understand what these triggers could be that your loved ones might experience. And when I say the word trigger, again, it is something that makes your loved one's lupus wake up. And that waking up can result in symptoms that lead to a flare. So some of the common triggers that can lead to a flare are stress. Well, you might say, Arnita, we're all dealing with a level of stress with all that's happening in our world, in our states, in our communities. We're all stressed. And I would agree with you. But there's a certain level of stress that goes beyond the level that all of us are dealing with. There's an elevated amount of stress. And those that are living with this disease, as well as you as the caretaker, when they are that additional amount of stress can trigger your loved one to have a flare. If the nutrition, what they're putting into their body, is not the most nutritious food, that can also be a trigger to wake up that gentle cub. If they are spending too much time in the sun between certain hours where the ultraviolet rays are very heavy, or if they're not getting enough sleep. Sleep has a very restorative power for those of us that are living with the disease and those of us that are not. Our bodies need time to restore, to rest, so that we can face the next day. If we don't give that to our bodies, then that means our bodies are fighting a lot harder to deal with all that we are engaging in as we are on this journey. Certain medications, I'm going to talk a little bit about the healthcare team, but certain medications can aggravate the lupus. And, we're out of the flu season, but we're now in allergy season. This video is actually being taped during Lupus Awareness Month. And far be it from me to say Happy Lupus Awareness Month to all of you that are in this fight. I want to acknowledge you. I meant to do that at the beginning, but I certainly want to acknowledge you that you are on a journey. And I want to acknowledge that this is Lupus Awareness Month. And this is also could be allergy season for some people. And as the allergies flare up, so may your lupus flare up, or the lupus of your loved one. Or perhaps you've been injured. That can also flare up and cause a trigger to the body. So again, when we talk about stress, everyone experiences, and I said, a certain level of stress, but it's that additional amount of stress. Give your loved one space to talk about their concerns. What are you living with? Ask them that open-ended question, how you doing? And then wait for an answer. Try to ask open-ended questions as opposed to what we call a closed-ended question, which, you okay? My response would be, yep, I'm okay. And I may not be okay, but I may not know how to share that with you. Help them to maintain a reasonable schedule of social events. Sometimes they may not want to go out. Respect that. Their fatigue level, although you may not see it on their face, inside, remember those invisible symptoms? Inside, they may be feeling really, really down or really, really tired. If they can't go out to the party, bring the party to them. Just see if you can help them stay engaged and help them practice relaxation techniques. Very, very important that they practice it as well as you. And so when we, again, talk about nutrition, helping your loved one to understand what nutritious foods are. I often talk about shopping on the outer aisles of the grocery store. That's where you'll find your fruits and your vegetables and your lean meats. Whereas on the inner aisles of the grocery store, you'll find your processed foods, which are not as healthy for the body to fight this disease. So eat a variety of healthy foods, a variety of vegetables and fruits, and know what triggers are not, what foods are not so good for your body and what foods are really good for your body. I've mentioned several times about being in the sun. The hours of 10 a.m. to 4 p.m. are when the sun's rays are the highest. If your loved one is very sensitive to sun, those ultraviolet rays that are coming into those hours, encourage them to wear a big floppy hat, which will protect their body from the sun. Encourage them to wear long sleeves or long pants, as well as a broad spectrum sunscreen. sunscreen. I'm getting a little tongue-tied here. Reapply the sunscreen after they started to sweat. You know, when we're outside, we don't think about reapplying, but when we sweat, that takes off a level of protection, and we want to make sure that we have that protection on. Again, sleep has a very restorative factor. Help them to set the stage in their bedroom for a good night's sleep. If they need to take a nap, have it be 60 minutes or less, and not too close to the time where they want to get a full night's sleep. But a little, a little nap here and there, that has a very restorative part for their body. Another lupus warrior wrote, anyone with lupus is truly an amazing person, and I totally agree. My daughter, this lupus warrior wrote, my daughter has it, and I am in awe as to how she handles all the pain and the symptoms. And I imagine you as a loved one, as a caregiver, are also in awe as how your loved one is able to go on about their day. I was in a walk for New York several years ago, and I saw someone with a t-shirt that says, "You don't look sick." And on the back of the t-shirt, it said, "And you don't look stupid." And what I love about that t-shirt is that don't make the assumption that because someone doesn't look whatever a sick look looks like, that they're not feeling the way that they are feeling. If they verbalize to you, Arnita, I am feeling really, really tired today, but you don't see it on their face, take what they say out of their mouths as truth, because that's how they're feeling. And we want to recognize and support them however they are feeling. And so now we're going to move to managing the lupus lifestyle, any triggers and any symptoms. What I also want to remind you is there is a box, I think it's an orange box that you might see, and it has a question mark in it. If you have questions, feel free to type your question in that box. You can press that box and type your question there, and I will not identify who asked the question, but I will verbalize, what your question is, as well as give an answer to your question. So feel free to ask questions as I'm going along. So another section that I love all the sections, communication, having conversations with your loved one. That can show up in a number of different formats, right? So how do you get the conversation started? Well, on the screen in front of you, there are at least 3 ways. One could be, I want to be able to enjoy the outdoors with you more often. How can I help make that easier for you? And then wait for your loved one to answer. Take what's on the screen, and you can always come back and revisit this presentation. But take what's on the screen and word it the way that you want to word it so that it sounds like it's coming from you and it's coming from your heart. You want to support your loved one. How can you do that? Ask them, what can I do to help you have a better day? They may say, well, Arnita, if you could make dinner, that would be a tremendous help. Or they may say, I'm not sure right now. Ask me in a little while. Respect that, but don't forget to go back and ask, because they may not think of it at the time, but they may think of it in a few minutes or maybe even a few hours later. I love this picture of this young man because it reminds me of how I interact with my loved ones, especially at the height of the pandemic. I was not always able to physically see my loved ones, but if I heard something in their voice, I would FaceTime them with my smartphone or with my iPad, and what my ears were listening to, what my ears heard, I could then see it on their face. And I could see where my son or my daughter was feeling a little down. I could see it in their face, and that helped me to respond a little bit better. So remember I said we're using all of our senses? So we're going to use our ears as we listen. We'll use our eyes as we look at them. We'll give them a hug if they need it. And we'll sometimes do an air hug if we need to. But making sure that you are scheduling time to talk with your loved one. It could only be a few minutes. It doesn't have to be long. But making sure that you are staying engaged with them. Text, phone call, video chat, communicate with them. A little while back, I talked about how lupus can affect the brain. Well, on your screen, you will see in front of you a reminder again that when lupus affects the brain, that these patients living with lupus, you that are living with lupus, you can become easily confused. You can possibly have memory issues, or you could have an inability to concentrate or something, or there may be so much external stimuli going on that your loved one just can't focus. Know that 50 to 80% of patients that are living with lupus experience what's called a lupus fog or a brain fog. Understand that this is very real. And let me give you an example. Patient is in with their healthcare provider. HCP comes in and says, okay, Arnita, I want to see you back in 3 months. I said, okay. I may not write it down. And then the nurse comes in and says, okay, Arnita, when does the doctor want to see you back? And I stop. And I give a blank stare. I'm like, And you may think, well, the doctor just left or the healthcare provider just left. Don't you remember? No, your loved one may not remember. So remember we talked about symptom tracking? If your loved one is in the healthcare physician's office, make sure they write down the instructions that they're giving, or perhaps you can write down the instructions that they're given. That's a way to help combat or help them overcome the symptoms that they may be experiencing with brain fog. Another lupus warrior wrote, the most difficult part is that people don't understand lupus. You have no idea how good it feels when someone cares enough to educate themselves because they love you and support you. It's a very lonely and isolating disease. And I want to stop right now and applaud you for showing how much you care for your loved one, for supporting them by receiving this education. You're helping. You're taking the time to understand what they are experiencing as they are living with this disease. It's not easy. It's not an easy journey. And this lupus warrior said that sometimes it can be very lonely. You're doing a lot by becoming educated. So do you feel comfortable talking with your loved one about lupus? I'm hoping by now I've given you a little bit of information and a little bit of ideas that you could use to ask them questions. And so a couple more communication tips. Be a good listener first and always. Listen, ask the question, and then wait for a response. Sometimes that response can come in a couple seconds. Sometimes it might come in a couple minutes. It may even come in a couple hours. But just be ready to be supportive as you listen. Be ready for some difficult subjects. The lupus warrior may say, this is really, really tough. Understand and show empathy. It is tough, Arnita. This is not an easy disease, but I'm here with you. Encourage them, support them, and share openly. If you have concerns, Arnita, I see you down, you're looking kind of sad, and this is the second day in a row. How can I support you? How can I help you? You can communicate with your words. You can communicate by sometimes leave a little note and say, I'm here for you whenever you need me. And encourage them to do the same thing. Sometimes they may not want to use their words, but encourage them to say, leave me a note. I'll find it. Let me know how I can help you. Set up places to devote time at home for rest and relaxation. It's a tough journey, and you are going through this journey with your lupus warrior. So communicating with your loved one, if you again have questions, please don't hesitate to put them in the chat. And we are on into the home stretch here. Let's look at healthcare management, helping your lupus loved one manage their healthcare. So as you see, it's like a winding road. There's someone that's like a team captain, and that's usually the rheumatologist, someone that specifically treats the lupus that your loved one is living with. That could also be a primary care physician. And if you have an adolescent, that could also be the pediatrician. The important thing as the caregiver is help your loved one keep everyone informed. If they're dealing with a pediatrician and the pediatrician decides to send you to a rheumatologist and the rheumatologist decides to send you to a cardiologist, make sure that all of them know what each one is saying, that all of them know the medications that you're on, and that you're keeping a list of what each one of them are telling you. Set reminders in your loved one's phone or even in your phone to remind them to set up appointments, to keep the appointments, to remind them to take their prescription medicine, the medication that's prescribed as their doctor, as it is prescribed, and then follow up with any questions that you may have or that your loved ones may have. I've mentioned a couple of times is be an appointment buddy with your loved one. Go along with them to the doctor's office and write down, because an extra set of ears, an extra set of eyes goes a long way. You can help them practice how they want to say something to a doctor. You do not need to use medical terms to share what you want to share. All of us are not in the medical profession, but all of us can say how we're feeling with whatever words we have in our brains to use to say that. Use what you got, and it's okay. It's okay. It does not have to be a certain way. In 2015, GlaxoSmithKline or GSK did a survey, and the results were from 200 patients living with systemic lupus erythematosus or SLE. There were 100 caregivers, and there were 75 physicians. And this study took place in the U.S., and it said 61% of patients said they minimize their symptoms or make them seem less severe and less impactful. That means more than 50% of your loved ones saying, I don't share all of what I'm feeling. That means I minimize it, I make it less, as opposed to sharing exactly how I feel. And then 3/4, that's over 75% of physicians believe their lupus patients have difficulty communicating their support needs to their loved ones. It's more than 75% of physicians. So make sure that you are communicating, that your loved one is communicating, and make sure you're hearing from your doctor. Ask them the questions that you want answered. This lupus warrior says, I was diagnosed in 1996. Every day is different for sure. The journey is definitely real, especially when some of your family and friends and your coworkers will never understand. Stay strong and be there for one another. These are words of encouragement from one lupus warrior to another. And this is how the lupus family communicates with each other on our usinlupus.com website. And so I asked you the question, have you helped your loved one with an appointment recently? If you haven't, make it a plan to help them with their next appointment. Make sure that you are asking the questions of the healthcare team. Do some research on your own about lupus. And I again applaud you for being here and learning more about lupus. Be practical. You can help gauge what goals are best suited for your loved one. Perhaps they have a goal of walking a certain distance without becoming short of breath. Perhaps they have a goal of making dinner 2 nights a week as opposed to 1 night a week. Make sure that they've shared that goal with their healthcare provider and put some steps in place on how together the healthcare provider can support your lupus warrior in getting there. That relationship between the lupus warrior and the healthcare provider is so critically important. Your lupus warrior knows their body better than anyone else, and the healthcare provider can understand what medications are needed to support your lupus warrior, and together they can help your lupus warrior live their best lupus life on this journey. And you, again, are that support person, are that caregiver that can help them. And so if there are any questions about how you can help your loved one manage their healthcare team, again, you are more than welcome to put them in the chat. And so this final section is about self-care. How are you taking care of yourself? Are you taking care of yourself? Caregiver stress is very real because you are on this journey with your lupus warrior. But have you taken the time to step back and take care of you? You face this emotional roller coaster with your lupus warrior. And it is both emotional, it's physical, it can be financial, and all of those can challenge all the different parts of your mental health. You may feel like you are on call, as the kids would say, 24/7, 7 days a week, 24 hours a day. But what are you doing to take care of you? How do you start to feel when you are stressed as a caregiver? Do you know what you feel? Do you know how you feel? Are you able to recognize, to identify when you start to feel stressed as a caregiver? And if you are, what do you do to help yourself? What do you do to help yourself? Do you take some time off? Do you call someone and say, I'm feeling really stressed right now, but Arnita needs some support. Can you come over and sit with her for a bit while I take a walk? While I go to the next room and listen to some music? While I go to the doctor's office and take care of myself? Understand what you can control and what you cannot control. We're going to work on what you can do to support yourself as you're supporting your loved one. And please understand, it is not selfish to support yourself, to be good to yourself. It is taking care of yourself. When we're on the airplane and that oxygen mask falls from the top, it says put your mask on first. So make sure that you are putting your mask on first. Make sure that you are taking care of you first, as then you take care of your loved one living with lupus. And so now I am going to push a survey out to you.
I know lupus. I know how cold can color fingertips. I know fatigue that causes calls out from work and cancels vacations. I know butterflies, unbending bones, and books of prescription. I know that ANA being positive can be a negative thing. I know holding your breath because oxygen flooding lungs can cause pleurisy pain. I know that anything on me that moves, that beats, can be inflamed. I know denial. I know not wanting to complain, not wanting to explain that just because I look good on the outside doesn't mean the inside is the same. I know red rashes on sunny days, aches on rainy ones. I know this wolf licks its chops, and sometimes it feels like nothing I do can keep it contained. I know this diagnosis forced my life to change. I know lupus. We know lupus. We know. Yet we know hope. We know resilience. We know that life can twist and shift itself into something brilliant. We know that broken dreams can transform into a mosaic, a masterpiece. We know recreation. We know adaptation. We know finding new passions. We know that lupus isn't all we be, but lupus is us. And us and lupus, it's a community, a place you can trust. Swap stories, ask questions, share our triumphs. Us and lupus, a guide offering advice on how to advocate for your patient rights, resources to help you discover what living your best life might just look like. Whether this experience is brand new or you're a more seasoned butterfly, Us and Lupus is for you, inspiring you to continue your fight.
Thank you to Chanel Gabriel. So I had said to you, I was pushing out the survey to you. It's that post survey, which is the purple box. And instead, I pushed out to you Chanel Gabriel, who is a poetess, a singer, and a lupus warrior. So I hope that listening to Chanel talk about how she knows lupus gave you another glimpse of what a lupus warrior is living with as they live with lupus. And so the post-event survey is a purple box that I'm hoping if I tried pushing it out to you with our platform, but if it did not come out to you, there's a purple box, and I'm asking that you answer the questions in the post-event survey. I also want to encourage you, after you answer those questions, that you also click the word submit. Sometimes we are answering questions and we might forget to hit the word submit, but please answer those questions and click the word submit. And I'm going to give you a couple more seconds. And then if you've already done that, I'm going to ask you to get your mobile device because I'm going to then put up the QR codes. We are near the end of our presentation, and I again want to thank you so much for hanging in there with me. I know that it's been a lot, but I so applaud you as the caregiver for taking the time to understand this disease for your loved one. I hope that you are taking away information that will help you to have a little bit more understanding about lupus for your loved one. And now I am going to share with you the QR codes. I am hoping that you can see them on your screen. There are actually 4. And again, if you take your phone and put it right up to the screen there, and then press the camera part of your phone, and you've got to put it right up to the screen, and you'll see something that says open in and whatever browser you're using. I happen to have Chrome, and it will put brackets, yellow brackets, mine does, right around that QR code. And then you can open up the usandlupus.com website, where once you open it and you'll scroll up a little bit, you have the opportunity to put your email address in there, and then we will be more than happy to send you some additional information about lupus. And so on the screen are 4 QR codes. To the very right, you'll see continue learning about the basics of lupus. Moving over, register for symptom tracking kit, and you can get that for your loved one and surprise them if they're not familiar with the usandlupus.com site. You can learn more about symptom tracking by the next QR code, and the one to the very far left is more caregiver resources. So I invite you take your phone, if you haven't done so already, up to the QR code, scroll down, because it will have to open in a separate browser. Scroll down, put in your email address, and that will sign you up to receive information from GSK or usinlupus.com. And finally, I want to thank you. Thank you for your time. Thank you for your commitment to your lupus warrior. And thank you for being here with us. Again, my name is Arnita Roberts-Christie from GlaxoSmithKline, one of the patient engagement liaisons. I'm so grateful that you joined us, and I'm going to check the question and answer. I do not see any as of yet, but if there is a question here, I'm going to look one more time. And I don't see any. Again, thank you so much for joining, and happy Lupus Awareness Month to all of you. Have a great day.